Saving life with high-flow nasal oxygen. Definition: First reported in 1890, first therapy with oxygen constitutes one of the fundamental advances in clinical medicine. It is an essential treatment for acute and chronic respiratory failure, a supportive therapy for general anesthesia and most surgical procedures, and an adjunctive treatment for patients with shock from sepsis, trauma, or cardiac failure. For spontaneously breathing patients with acute respiratory failure, various methods from providing supplemental oxygen have been studied. There is a video.
Patient who has tested positive for influenza A and is in severe ARDS. The CT scan has confirmed the same. Here we elaborate the use of a high flow nasal cannula in this patient as a substitute for NIV support. This is a pure hypoxic respiratory failure because of viral pneumonia. The patient was earlier on NIV support. Here we have used this high flow nasal cannula and the patient is breathing comfortably. Otherwise she was desaturating to around 70 to 80% saturation on a traditional nasal cannula. This one provides a high flow rate, otherwise used with the air oxygen blender, but here we have used this ventilation mask as a substitute for air oxygen blender and the active heated humidifier with the face mask setting. You can see this temperature setting for a face mask. Otherwise
Application on medicine. Aspect 1. Nasal flow of oxygen is able to provide precise oxygen levels even at high concentrations. Aspect 2. During the nasal oxygen flow, atomic dead space of the upper airway is compensated by high gas flow inlet, providing a kind of reservoir of constant fresh gas available for each patient breath, reducing the level of carbon dioxide. Aspect 3. Oxygen nasal flow in combination with maintains optimum mucociliary clearance. This is especially important for patients suffering secretion problems, reducing the risk of respiratory infection. There is a video about high flow oxygen therapy section from the oxygen therapy.
Now let's look at the high flow devices. These provide sufficient flow of gas to meet all of the patient's minute ventilation requirements. Let's look at when a high flow device might be more appropriate. Patients with chronic lung disease and CO2 retention whose ventilation is dependent on hypoxic drive. This is an overemphasized condition in which the usual stimulus for respiration, maintenance of a normal CO2, is lost due to chronically high CO2 levels. Respiration is then driven by hypoxia. If high concentrations of oxygen are given to these patients and their PaO2 goes up too much, this hypoxic respiratory drive can be lost. Hypoventilation may occur and the CO2 will become very high, causing coma and possibly death. In this instance, a high-flow device in which the oxygen concentration can be carefully controlled and guided by blood gas measurements is more appropriate.
The pros: setting running nose lower than 50 L than minute. Respiratory gas under optimal condition. PAP low blood pressure. It reduces the dead space in the nasal pharynx. Greater patient comfort, compliance, and oxygenation. CO2 reduction. Ability to speak, eat, drink, and sleep. The cons: it is thought to be more comfortable for the patient than the other strategies and may reduce the work of breathing. Importantly, it increases the excretion of carbon dioxide. Some studies have shown a potential role for the high flow oxygen in supporting patients with hypoxemia after extubation 7 and in treating newborn infants with respiratory distress. There is a video about high flow nasal cannula.
Verify the physician's orders by checking the patient's chart and armband. Make sure you have all the equipment ready to set up your high-flow nasal cannula. Attach the oxygen thorpe tube into the wall outlet. Don't forget, righty-tighty, lefty-loosey. Then attach the high-flow bubble humidifier to the DISS outlet by screwing it onto the flow meter. If humidifier does not come pre-filled, fill it with sterile water up to the max line. If there is already water in the humidifier, dump it out and refill with fresh sterile water. No topping off. Attach the nasal cannula to the outlet on the bubble humidifier.
Issued applied in Ecuador. In the most central hospital, oxygen exists. The oxygen is stored in the central, located outside the general hospital building, and reaches the rooms of the sick as through pipes. When central oxygen exists, all rooms have a shot of oxygen, with a stopcock at the head of each bed. Conclusion: I believe that high-flow oxygen therapy through a nasal cannula should be considered to be an effective and safe therapy for the treatment of spontaneously breathing patients with acute hypoxemic respiratory failure. Although additional trials are needed, high-flow oxygen should be used to the treatment of patients without hypercapnia and with acute severe hypoxemic respiratory failure in the emergency department, the intensive care unit, and hospital settings in which appropriate monitoring is available. The last video about oxygen therapy, nasal cannula, and face masks.
Hi, my name is Jackie Russick, and I'm going to show you today the use of a nasal cannula for oxygen delivery to the patient. This is a nasal cannula, and one of the reasons we use this is that it's simpler for the patient. It's more comfortable than simple face mask. I'll talk about simple face mask in a little bit. I just wanted to show you the difference. The way we put this on the patient is these two prongs. This is where the oxygen is going to be coming out and going to the patient. These two prongs get placed this direction, not the opposite direction. They're placed where the prongs are arched towards the back of the head of the patient. Each one is placed inside one of the nares, and this tubing, you can slide this to tighten or loosen this tubing. The tubing is placed, there's different ways you can put this on. I've seen it where it's placed like this and the tubing is put behind the patient's head. Is if you place these in the nose, give yourself enough room to place this behind the patient's ear. What you want to make sure is that it's not too tight